Hi, everyone. This is Dr. Corolla Okogbaa again. Thank you for joining me for another time together, discussing our eye health and having this eye health conversations to help improve our eye health, maintain our eye health, and keep them going and moving along to the best of their ability. And today, I want to continue to discuss uh, age related macular degeneration. So, today, let's discuss who gets this. Some of the questions I get sometimes is, well, am I at risk? Can I get it? So, a lot of these conditions, we know that we age, okay? It's the leading cause of vision loss in folks 50 and above. And that means just by age is a risk factor. So the older we are, the more at risk the eye is to developing this condition. Also, family history. Family history is a very strong one. If you have a family member, particularly a parent, siblings, then your risk of developing macular degeneration also increases as well. Other things are lifestyle, such as if you have high cholesterol, if you have a diet with high saturated fats, that also increases macular degeneration development. Okay. And one big one, smoking. Smoking has been linked specifically with studies that it has a huge impact on the development. It's at least four times more likely, you're four times more likely to develop um, macular degeneration if you're a smoker. Okay, so we talked about all these risk factors. And of course, race is also a risk factor. If you're Caucasian, you're more likely to have this condition, but anybody can have it. So those are the risk factors for getting this. And how do we diagnose it? So when you come in for an eye exam, we do an exam of your eyes from front to back. And one of the things that we look at is really we look at the health of your retina, and we're looking for any areas that are not what we call normal, right? So if we look at, we could find any, if we see the tissue is atrophied, like it's dying, or the tissue has deposits in them, that's usually an indication that this is the start of, or this is macular degeneration. Then we have you do some tests, um, such as an OCT, to look at the structures of the retina to see where these deposits are. We then do further diagnostic tests to see if there's any leakage going on. Is the tissue blood vessels, or any blood vessels growing and causing leakage in the back of the eye? So those are some of the things that we use. We also look to see, we use something called an Amsler grid, where your doctor will hand you um, something that has a grid on it, and we're having you killer. And what we're looking for is to make sure that the lines are straight, that they're not crooked, because if they're crooked or wavy, that's an indication that yes, macular degeneration is having an impact already on the cells of the macula, and therefore on your vision. And so those are some of the things we look at, and that helps us to diagnose the condition. It helps us to categorize: is it dry, is it wet, and also where are we in the stage of the disease? Are we in the early stages? Are we in the moderate stages? Or are we in the advanced stage? And so that's those are some of the things that we do to identify macular degeneration and to diagnose. What will you see? What are some of the symptoms? We already talked about it: blurriness right in the center vision. Your peripheral vision will be fine, but it'll be right in the dead center. Things are just not clear. It's like a spot that's not going away. Things are wavy, blurry, and That's really the biggest thing. And sometime in the early stages, you may not see anything. And that's why it's very important to get your eyes examined regularly. I cannot stress that enough. Even when you feel everything's working, oh, my vision's good, it's always great or even better to see your ophthalmologist, get a clean bill of health, and make sure that your eye health is really good, that it's doing what it needs to do to function for you. Okay, so that's what I have for you today. And please share this video with someone in your life who may find this information helpful. And if you have not gotten your eye exam, I recommend that you call your ophthalmologist. And if you're local to our area and you're looking for an excellent eye doctor, check us out at www.lacenterforeyes.com or call our office 225-356-2655. Thanks again, and I will see you next time. Take care.